Health authorities and international travel hubs are entering a period of heightened vigilance as a cluster of rare hantavirus infections, specifically the Andes virus strain, triggers a coordinated global response. The situation began in early May 2026, following the reporting of a severe respiratory illness cluster aboard the MV Hantavirus, a Dutch-flagged expedition cruise ship. While hantavirus is traditionally associated with exposure to rodent excreta, the current situation has raised significant alarms due to the confirmed presence of the Andes virus, which is the only known orthohantavirus strain capable of human-to-human transmission. This development has moved the story from remote wilderness surveillance to the forefront of international aviation and transit security. The World Health Organization, alongside the European Center for Disease Prevention and Control and the Africa CDC, is now tracking a series of cases that span several continents, originating from a single voyage that departed Ushuaia, Argentina, on April 1. The framing of this public health event is critical, while the general risk to the global population is currently assessed as low. The specific logistics of air travel and the movement of passengers from the affected vessel have prompted airports to implement targeted surveillance protocols, reminiscent of previous respiratory pandemics. This includes the monitoring of passengers who disembarked at various stops along the South Atlantic route, including St. Helena and the Canary Islands. The primary concern for public health officials is the high mortality rate associated with hantavirus pulmonary syndrome, which can exceed 38%. Unlike common seasonal viruses, hantavirus typically presents with a rapid progression from standard flu-like symptoms, fever, muscle aches and fatigue, to acute respiratory distress and shock. The current focus remains on the MV Hantavirus, where at least 8 individuals have been identified as confirmed or suspected cases, with 3 fatalities recorded to date. One of these fatalities occurred during a transit flight to Johannesburg, South Africa, a development that has directly influenced the renewed discussions surrounding mask requirements and health screenings in airport environments. This episode will detail the specific movements of the infected individuals, the laboratory confirmation of the Andes strain, and why the potential for person-to-person spread in confined spaces like aircraft and cruise cabins is forcing a reevaluation of current international travel health mandates. The core of the current hantavirus development lies in the complex logistics of the MV Hantavirus itinerary and the subsequent dispersal of its passengers. According to official reports from the Dutch government and ocean-wide expeditions, the ship was carrying 147 passengers and crew when it departed Argentina. The index case, identified as a Dutch national, had reportedly engaged in a 4-month overland road trip through Chile, Uruguay, and Argentina prior to boarding the vessel. This individual presented symptoms as early as April 6th and passed away on board on April 11th while the ship was in the South Atlantic. Following this initial death, a cluster of similar respiratory illnesses emerged among other passengers. The international nature of the crisis escalated when several dozen passengers disembarked the ship at St. Helena and Cape Verde to return home via commercial aviation. On April 25, a secondary case involving a passenger traveling from St. Helena to Johannesburg resulted in a medical emergency mid-flight. That passenger later died in a South African hospital. This specific incident has led to the isolation of a KLM flight attendant and the monitoring of dozens of other travelers who may have had close contact with the deceased. In Europe, the Swiss Federal Office of Public Health confirmed that a man who had returned to Zurich from the ship was hospitalized and tested positive for the virus on May 6. Meanwhile, 3 other symptomatic individuals were transported via air ambulance to the Netherlands for specialized treatment. Laboratory testing conducted by the Institute for Health Security and other regional centers utilized polymerase chain reaction, or PCR, to confirm the presence of the virus in blood and respiratory samples. These labs specifically identified the Andes virus strain through genomic sequencing, which confirmed the fears of public health officials regarding potential person-to-person transmission chains. In response, the Spanish Ministry of Health has prepared a command post in Tenerife, where the WHO Director General is expected to coordinate the final evacuation of the remaining passengers. Officials are currently contrasting the initial claims of a contained rodent-based outbreak with the verified evidence of a multi-country transmission event. While no lockdown in the traditional sense has been enacted for entire cities, specific transit corridors and aircraft are being subjected to mandatory disinfection and quarantine regimes. The data suggests that the virus remains most dangerous in settings of close, prolonged proximity, which is why the focus has shifted so heavily to the logistics of the cruise ship and the specific flights taken by disembarked passengers. Prevention and public guidance regarding the Andes hantavirus differ significantly from standard public health advice due to the virus's dual transmission pathways. Generally, hantaviruses are contracted through the inhalation of aerosolized particles from the urine or droppings of infected rodents, such as the long-tailed pygmy rice rat found in South America. However, because the Andes strain can spread between humans through respiratory droplets during close contact, the prevention strategies currently being deployed at airports and on the MV Hondius include the mandatory use of high-filtration masks and the enforcement of physical distancing in indoor settings. Public health agencies are emphasizing that while the situation is serious, it is currently limited to a known group of travelers. The surveillance strategy involves identifying every individual who was on the vessel or on subsequent flights and placing them under a 21-day observation period, which matches the upper limit of the virus's incubation window. For the general public, health officials advise against panic, noting that there is no evidence of the virus circulating in the community outside of these specific travel-related clusters. There are currently no approved antiviral therapies specifically for hantavirus pulmonary syndrome, making early detection and supportive intensive care, including mechanical ventilation and extracorporeal membrane oxygenation, the only effective interventions. The limits of current knowledge include the exact degree of transmissibility for this specific substrain of the Andes virus, and whether it has undergone any mutations that might make it more contagious than previous outbreaks seen in Chile or Argentina. Scientists are also investigating the specific environmental conditions on the ship that may have facilitated the cluster. As the MV Hondius approaches the Canary Islands for medical processing, the international community remains in a state of watchful waiting. Public health officials maintain that the risk to those who have not traveled to the southern cone of South America or been in direct contact with the affected ship remains low. The call for masks in airports is a targeted precautionary measure designed to break potential chains of transmission among high-risk cohorts, rather than a signal of a new global lockdown. For ongoing updates on this developing story and further reporting on international health security, consider subscribing to this channel. The epidemiological investigation into the MV Hondius cluster has pinpointed a Dutch national as the likely index case, US, following a 4-month overland journey through South America that concluded just before the ship's departure from Ushuaia on April 1. According to reports from the Argentine Ministry of Health and the Dutch National Institute for Public Health and the Environment, or RIVM, this individual had traveled extensively through Chile and Uruguay starting in late 2025, areas where the Andes virus is endemic in rodent populations. He first reported symptoms on April 6 and succumbed to the illness on April 11 while the vessel was in the South Atlantic. The complexity of the situation escalated when his wife, who had been in close contact during the voyage, disembarked at St. Helena on April 24 and subsequently died in a Johannesburg hospital on April 27. A third death, involving a German passenger on May 2, further solidified the severity of the outbreak. Laboratory confirmation was achieved through a multi-stage process involving PCR testing and advanced genomic sequencing. Initial results on May 2 confirmed the presence of hantavirus, but it was not until May 6 that sequencing at the European Union Reference Laboratory for Emerging or Viral Zoonoses confirmed the specific Andes virus strain. This finding is critical because, unlike other hantaviruses that are only spread through rodent excreta, the Andes variant is the only known strain capable of interhuman transmission. The response from international health agencies has been swift and multi-layered. The U.S. Centers for Disease Control and Prevention has elevated the incident to a Level 3 emergency response, while the European Center for Disease Prevention and Control, or ECDC, released a threat assessment brief detailing the risks to the 9 EU member states with citizens on board. Maria van Kerkhove, representing the World Health Organization, emphasized the distinction between this outbreak and the COVID-19 pandemic, stating that while the virus spreads very differently and is not a respiratory virus in the traditional sense of influenza, its long incubation period, potentially up to 6 weeks, requires extended monitoring. In Singapore, the Communicable Diseases Agency has isolated 2 residents at the National Center for Infectious Diseases after they disembarked the Hantavirus and traveled via the same commercial flight to Johannesburg as the confirmed fatal case. One of these individuals remains symptomatic with a runny nose, while the other is currently asymptomatic. Singaporean authorities have implemented a 30-day quarantine for these individuals, to be followed by a 45-day total monitoring period from the date of their last exposure. Logistical efforts to manage the remaining 147 passengers and crew have involved several high-stakes medical evacuations. On May 6, while the ship was anchored off the coast of Cape Verde, specialized medical flights picked up 3 individuals requiring urgent care: a 56-year-old British national, a 41-year-old Dutch national, and a 65-year-old German national. These patients were transported directly to specialist facilities in Europe, including the Amsterdam University Medical Center and the Central Military Hospital in Utrecht. Meanwhile, a British passenger previously evacuated to South Africa on April 27 remains in intensive care but is reportedly in stable condition. The British government, led by Prime Minister Keir Starmer and Foreign Secretary Yvette Cooper, has confirmed that the UK Health Security Agency is working alongside the WHO to facilitate the safe return of the remaining 19 British passengers and 4 crew members. The ship itself is currently en route to Tenerife, in the Canary Islands, where Spanish health authorities have established a command center to oversee the final medical processing of the vessel. Despite initial objections from local regional leaders, the Spanish Ministry of Health confirmed the docking was authorized under international law and humanitarian principles. Officials are currently tracing approximately 30 to 40 passengers who disembarked at various stops before the outbreak was fully recognized, a global race to prevent further transmission chains across the 12 countries involved in the itinerary. As the international community grapples with the fallout of the MV Hantavirus outbreak, public health guidance has pivoted toward a dual strategy of environmental containment and human-to-human transmission prevention. The primary directive from the World Health Organization and the Centers for Disease Control and Prevention centers on the unique properties of the Andes virus strain. Unlike other orthohantaviruses, which are strictly zoonotic, the Andes strain requires a close contact protocol. This has led to the reintroduction of mandatory high-filtration masking, such as N95 or FFP2 respirators, in specific transit corridors and aboard flights originating from southern cone regions or those connected to the affected cruise line. Officials emphasize that for the general public, the risk remains minimal. However, for those who have recently traveled in rural South America or were in proximity to the ship's route, the guidance is clear: monitor for high fever, severe muscle aches, and sudden shortness of breath for a period of up to 60 days. Practical prevention in endemic areas remains focused on rodent exclusion. Public health authorities advise against sweeping or vacuuming areas where rodent activity is suspected, as this can aerosolize the virus. Instead, a solution of 10% bleach should be used to soak inner droppings or nesting materials before they are wiped up with damp cloths. The surveillance effort is now one of the most significant contact tracing operations since the early 2020s. Authorities in the Netherlands, the United Kingdom, and South Africa are currently monitoring approximately 150 individuals who were exposed during the voyage or subsequent air travel. This surveillance is not merely a suggestion. In many jurisdictions, it involves daily check-ins with health departments to report temperatures and any emerging respiratory symptoms. The limits of current medical knowledge, however, provide a sobering context for these measures. There is currently no widely available vaccine for hantavirus, nor is there a specific antiviral drug that has been proven effective in clinical trials for hantavirus pulmonary syndrome. Treatment remains entirely supportive, relying on early hospitalization and intensive care interventions. Medical facilities in the Canary Islands and the Netherlands are prepared to utilize extracorporeal membrane oxygenation, or ECMO, which bypasses the lungs to oxygenate the blood, a critical intervention given that the virus typically causes the lungs to fill with fluid. Experts at the London School of Hygiene and Tropical Medicine note that while the virus is lethal, it does not typically possess the high R0 or reproductive rate seen in viruses like measles or influenza, which may help in containing the current cluster. The ethical considerations of this response are being carefully weighed by global leaders. There is an active effort to avoid the stigma and travel bans that have characterized previous outbreaks, focusing instead on targeted screening and informed vigilance. The return of mask mandates in specific airport terminals has sparked debate, but officials argue that the high mortality rate of the Andes strain justifies a precautionary principle approach until the transmission chain is fully mapped. The honesty regarding the limits of our knowledge is a key component of current official statements. We do not yet know if this specific substrain of the virus has adapted for more efficient human-to-human spread, or if the environment of the cruise ship provided a unique set of circumstances that facilitated the current cluster. This uncertainty is why the extended quarantine periods for disembarked passengers are being strictly enforced. As the investigation continues, the focus remains on transparency and the rapid sharing of genomic data between laboratories. This situation serves as a stark reminder of the intersection between remote wilderness environments and the high-speed networks of global travel. For more in-depth reporting on emerging health security and global surveillance, please consider subscribing to our updates.